graduate students panel. So
hi everyone. Thank you for attending the ISU Pre-Health Conference. There'll be more people coming in gradually, I assume. And then my name is Zaina, and I'm one of the PT outreach chairs. If you're here right now, that means you're in the physical therapy graduate student panel. So if this isn't the Zoom you were looking for, you could go back to our website and to find the appropriate room. So just a quick rundown of how this is going to go. I'll have the students introduce themselves by stating their names, education, and after introductions, I'll ask one or two questions from the ones that you guys have sent us. And we'll also have a live Q&A where you can put in your questions, also upvote the ones you'd like answered, and we're going to go through those as well. And then if you have any additional questions, you could put them in the chat, and I'll also be monitoring that.
And we'll just ask a few questions. If you guys have any questions, there is a Q&A option.
So I think that we could get started with our introductions. So first we have Tyler.
Hey, I'm Tyler. I'm from Ohio University studying physical therapy. I'm in the middle of my second year at Ohio University, and I graduated from Iowa State in 2019.
Next we have Allison.
Hi everyone, my name is Allison. I graduated from Iowa State in 2020. I was a kinesiology major, and right now I am at the University of Wisconsin-Madison, and I am doing a dual degree program, so I am getting my Master's of Public Health along with physical therapy school.
Next we have Brian.
All right, hi guys, I'm Brian. So I'm actually a physical therapist. I graduated from the University of Iowa about a year ago. So I feel like I can give a little bit more perspective into like the boards and kind of the things maybe after school. So I'm actually practicing here in Johnston. I've been practicing for about a year. Johnston is around the Des Moines area in Iowa. So yeah, excited to be here.
Then we have Lexi.
Hi, I'm Lexi. I'm up here in Minnesota. I'm currently living in Burnsville, going to St. Catherine University or St. Kate's in St. Paul. I'm in my third year, so getting ready to take the boards. I'm in my third and final clinical, and I went to the U of M Twin Cities for my undergrad in kinesiology.
Then we have Noah.
Hey guys, my name is Noah. I'm a first year PT student at Des Moines University. I graduated from Iowa State with a kinesiology degree in 2020.
Next we have Madison.
Hi everyone, my name is Madison. I am a second year PT student at the University of Illinois Chicago, and I graduated from Baylor University down in Texas.
And lastly, we have Jane.
Hi everyone, my name is Jane. I'm also a second year. I also go to University of Illinois Chicago with Madison. I did my undergrad in University of Rochester in New York.
All right, so we'll get started with our questions. So the first question that we have is, what is the most difficult part, did you believe, of the application to complete for like your school? And then if we could have Tyler start us out, that would be wonderful.
Okay, so the difficult part of the application was probably like certain schools require essays. So I'd say that probably required the most work for the submission process. But I guess finding those letters of recommendation, because you usually need one from like a professor, one from a physical therapist, and then like you get an extra one. So finding someone to write you one of those was probably the most difficult or took the most time.
right, thank you. I guess another thing kind of goes into the application. I guess if somebody else wants to go into it, is what's something that you wish you knew before you started your applications, or you wish you had done differently?
I can kind of elaborate on that a little bit. So maybe not done differently, but something that I felt was really important was getting a variety of observation hours. And not just in a single clinic, but I would do, multiple types of observations. So with physical therapy, there's, so many different avenues you can go down, like hospital-based, which is acute care. There's rehab facilities, outpatient ortho, which is your typical PT that people might think of. There's skilled nursing, there's home health, there's so many different options. I feel like PT schools, I know the University of Iowa does look at, what kind of breakdown you have. So they like to see a variety of options so that that there's more than just one type of physical therapy out there. So I think that's one thing that would be really beneficial to people who are looking to start that application process, and to start that, sooner rather than later too.
Yeah, kind of going off Brian, I think maybe not what I would change, but something I think that really stuck out was I know Des Moines University looks for like leadership roles and how you can kind of take that. And I think one of the biggest things, or like students can struggle with, I think, is finding that, or maybe even for like labs with professors. That's a good way gaining that relationship and building that throughout your 4 years, or as soon as you can, if you find a class that you enjoy. I know one thing I did too was TAing an undergrad TA, helping out with like anatomy and different things like that, because it just helps you. You can never get enough of it because you're going to see it pretty much for your entire career. So it doesn't help to kind of, just go from there. So I think that's definitely a big thing with leadership roles, finding those early.
All right, thank you. For one of our live questions, we have one directed to Allison. They asked, what is the Master's of Public Health degree related to physical therapy? Is it open? Is it to open your own physical therapy clinic?
Yeah, so it's kind of really up to you how you want to use it. So I can kind of speak to why I chose to pursue the MPH. So really, I wanted to add on the MPH to really kind of supplement my career as a clinician, to be able to have that background. I just think that there's so many different perspectives in public health that can be really beneficial in the clinical setting. And so the way that my program's structured, I don't have to pick a specific track. I can really take in all kinds of different information on public health, on health equity, social determinants of health, those sorts of things. And so really being able to have just a different perspective when you're working one-on-one with a patient, and you're kind of thinking about all these other external factors that relate to their health besides just sitting one-on-one in a clinic.
Thank you. And then, so on to another live question we had is, this is open to anybody, but how many schools did you apply to? All right. To the next question, thank you guys for that, is how did you choose where you wanted to attend grad school?
I can go about talking about this. For me, a big part of how I chose where I wanted to go was how much the tuition cost, because we all know that DPT is a pretty expensive program, and we don't want to spend too much money and have to pay back loans on loans on loans. So that was a big part that this helped me decide where to go.
I can chime in too. So tuition was definitely a big part of that, but also, at least for UIC, where me and Jane are at, they hosted an open house for all of the applicants that they had accepted. And they had all of the professors come and just kind of introduce themselves, share about the program. We got to meet some of the first and second year students there as well. And I knew that for me, I was interested in peds. I had done a gap year working at a peds clinic, and here at our university, two of our professors are very knowledgeable about peds. They still practice, and then they teach some courses about peds. And so from the get-go, I kind of knew like this was a really awesome spot for me to learn about that and just like further my knowledge. So for me personally, it was just like getting to know the school, getting to know the professors, seeing where the school's strengths are, and then kind of basing my decision off of that.
All right. I guess I wanted to direct this back to Madison because I noticed that you said you took a gap year. So one of our live questions was, did any of you take a gap year? And if so, did you find it beneficial?
I can start. So it was an unplanned gap year. I graduated from undergrad in 2018, and I had applied my senior year, and I didn't get into any schools. And so I was like, okay, I guess I'm going to be working for a year, just getting some more experience. And honestly, it was the best decision I made. I learned so much. I learned not just like skills and like observing the PTs, but also just a lot about like kind of the behind the scenes, more about like administration things that you don't really learn that much about in school, but just like knowing more of the background of how a clinic works. I also was at a clinic with OT and speech as well. So getting to see the different disciplines and how they interacted was really awesome. And again, like not an experience you get that much in school. So I'm like a big proponent of it. I definitely recommend it. Not only do you get a lot of experience, you can get reference letters, you can get more observation hours, but also you can make a little bit of money at the same time, which is always kind of a nice thing. So yeah, I definitely recommend if you're thinking about it.
I can answer that question too. I took a couple years off. I graduated from undergrad in 2015 and started PT school in 2018. And I'm really glad that I had that time because, like Madison said, you have time to get your shadowing hours in. You have time to get those volunteer opportunities in that really build up your application. You have time to work on your essays, which I spent about 6 months on, and I wish I would have started sooner. So it's a great way to get more of that experience in and see those things that are really, because I'm a really hands-on learner, and to be able to see those things up close and personal and be experiencing them myself really helped with all kinds of stuff in PT school, and it really helps build up your application.
All right, thank you. And then our next live question was, how do you go about getting a variety of observation experiences, internships, or excuse me, small job shadows?
Yeah, so I can kind of answer that one since I kind of brought that up. So I'll just talk about my experience. So I think I started shadowing when I was probably a freshman or sophomore in college, and I went to Dordt College. I don't think I mentioned that, which is a small college in Iowa. But anyway, so what I did is usually during the summer, when I was back home for the summer, I shadowed a PT that I knew from high school, outpatient ortho. That was kind of what I thought I wanted to get into. So I started with that, and I got maybe 50 to 75 hours at his specific clinic. And then I also actually reached out to Mayo. So Mayo in Rochester, Minnesota. So I reached out to them, I think maybe a year or two in advance, saying like, hey, I'm looking for potential shadowing opportunities at your clinics. It was nice because I had my aunt actually works there, so I did have a little connection there, but that was really great. I went there for a week. I shadowed for, I think it was 40 hours, a different clinic each day. So I felt like that also kind of stood out on my my application as well. And then I think I did like an acute care, So I think the best way is just looking in your area and then reaching out to, they usually, if you just reach out to the clinic, if it's an outpatient ortho or the hospital, just saying like, hey, I'm a student interested in physical therapy. Is there any way that I could, just get some shadowing hours? I think is probably your best way to go about it. Again, it's kind of new territory with COVID. So I know every clinic does things a little bit differently. I know at our clinic, we just recently started allowing students back into shadow. So I think you just kind of have to reach out and just see what their specific protocols are. And I think that's probably your best bet to go about that.
Next we have, did you find the application process difficult? Was it competitive?
I'd also like to add, I think requirements have changed. I don't know if this is PT wide, but I think I've heard that requirements have changed for shadowing hours. So I would look into the programs that you're interested in and see if those requirements have changed. Also for me, I started shadowing at an outpatient clinic because my grandma had a knee replacement and she talked to her PT and she said, yeah, my granddaughter's interested in PT because she spent some time with you. And my other grandma had spent some time in a transitional care unit. And so there was another connection there. And that ended up being, it was observation hours that turned into being a rehab aide part-time. So your grandparents might be a good resource if they're getting that kind of care.
All right. So to our next question, I guess, is what has been something that took you by surprise when you first started graduate school?
I can go first. So, I mean, the amount of work is obviously a lot. You get a lot more in grad school compared to undergrad. But also, I didn't consider being a physical therapist in class, you'll be shirtless a lot, at least at my school. So I didn't really realize that until the first day of class. So if you needed any extra motivation, like exercise and get in shape, this should probably do it.
All right. And then another live question is, what questions would you recommend asking schools when you're trying to figure out which school is best for you?
I can, oh, go ahead.
Okay, sorry. I was just going to start